Welcome, everyone, to another episode of Hashtag On Point with Dr. Pam. Today, we're with Stephanie Rousseau, and she is absolutely the perfect person to help us understand some options for healthcare that include an industry disruptor. Stephanie, I want to welcome you. How are you?
Hello, Dr. Pam. I am blessed. Thank you so much for having me today. How are you?
I'm doing well too. And I want to let the audience know the reason that I really believe that if some of what Stephanie and I discussed today with healthcare sharing is something that piques your interest, the reason she's the perfect person to reach out to is because she spent at least 20 years in higher education. And what do we know about people in higher education or education at all? They tend to explain things easily and well. And healthcare can make people want to run out of the room screaming. So when you get the opportunity today to listen to Stephanie, you'll see why it's so important to reach out to her for further information. But also, she has for a very long time given back to her community. And Stephanie, tell us a little bit about that. Now, I want to be clear, Stephanie's a business owner now, a thriving business owner. Stephanie, tell us a little bit about yourself.
Sure. Thank you so much, Dr. Pam. Well, as you mentioned, I did work in higher education for over 20 years as a senior administrator. And so I do have a master's degree in education, love learning. I stepped out on faith probably back in 2009 or 2007, I can't remember, to pursue my passion for entrepreneurship. I love helping people and empowering others as well. And so that's what I want to talk about here with the healthcare, because I want to make sure that no one is left behind. And I want them to know that there are options. And a lot of times that's just it, that people don't know about other options. And so I want to be able to share with them that. But as you mentioned, I am a multiple business owner, so I do give back. I do own an online bakery, and so I make homemade pound cakes. And so we do purchase food baskets, and we give those out to elderly and sick and shut in. And with this particular company, when you become a customer with us, a meal is donated, to feed a hungry child in the local zip code.
Wow. Is that part of the healthcare sharing?
That is part of, the healthcare sharing
Wow.
here today. And so we do that because I
want to just make sure everybody knows, Stephanie, that not only does she give back of her time and she ties to the community, right? Mm-hmm. She joins and works with businesses that also do the same. So I want everyone to understand that healthcare option that she'll explain a little bit today, they donate a meal. Did I get that right?
That is correct. So there's 17 million children in the United States that was going to bed hungry. And so we partner with Feeding America, which you may be familiar with. And so when you do become a customer, a child is fed in the local zip code of that customer.
Oh, nice.
So I'm excited. Yeah, I'm so excited about that. And so I just want to kind of get right into it. So as you know, and I believe that you deserve simple and affordable healthcare that's comprehensive, medical care that is inclusive of free telemedicine, great prescription pricing, and mental health. So we had someone who is on the program who, prior to getting to the program, she was paying $600 a month for a prescription.
Wow.
Yes. But you know what? You need that prescription. And so when she came on board with us, guess how much she's paying for that same prescription now?
How much?
$3.
Wow.
So that's $597 going back into her budget.
Right.
And that can make a difference. When we're looking at, they're saying compared to last year, we're paying 19% more on the same goods and services that we were paying for on a year ago, which is equating to an extra $500. You go to the grocery store, you go to the gas pump, you see we're paying much more. And so
that's so important right now too.
It
because
is.
It's not in it. Yes, because then she can thrive in other ways.
Yes, she can use that money to go into other ways instead of paying for the same prescription as she needed. So we're going to talk today about being disruptors. And so, as you know, being a disruptor in the industry, let's look at a couple of disruptors that have taken place that we're familiar with. Okay. So when you experience a disruptor, you're going to have sometimes a better experience or a different experience and a better pricing. And so it's just a better opportunity that you can make a decision to see if that's something you want to participate. So let's look at Uber and Lyft, how they disrupted the taxi cab and, that industry. Now, do they still exist? Yes, you can still catch a cab or a taxi, but Uber and Lyft are really making an impact in that industry as well. So there are some people who are saying, you know what, I'd rather take an Uber or a Lyft. And so they are doing that, which provides a better selection for them and better pricing as well. Same thing happened in the real estate industry, in hospitality. Look at Airbnb and the hotels. That was a disruptor there as well. Again, hotels still exist and they still will exist because you do have that customer who wants the hotel, but you also have that impact of the Airbnbs. Look at how many are in the community now and how many people are using those for hospitality now. So the same thing happened in healthcare. You have an alternative and it is called healthcare sharing. So when you're considering healthcare, I want you to know there are options. You now have the opportunity to select a plan that allows you the freedom to choose the doctor or the dentist of your choice. It's not an in-network, out-of-network. It's of your choice because sometimes we get sick and we need to have a particular doctor and we don't want to say, oh, well, I'm sorry, it's out of your network and it's going to cost you much more. Now, I inadvertently was given some medication that left me paralyzed for a while.
Whoa, Stephanie!
They had to get a doctor all the way down in Florida. And they did the telemedicine where they brought the computer in and he was able to diagnose me. Now, I'm trying to figure which way to go.
Now, listen, that telemedicine, do I remember that there's no cost for telemedicine?
No, it's free. Yes, it's free. And so they brought that in and had the computer there and he was able to diagnose me. The nurse was there. They were able to touch my legs and all of that. But he was the expert that we needed. And because the doctors up here could not figure out what was wrong.
So wait, Stephanie, I want to clarify. I want to make sure I heard this correctly. So you needed some expert care. And while you were at the doctor, the telemedicine was able to help you in addition to being at the doctor's office because
I was in the hospital.
Okay.
I was in the hospital, but no one here in the
had the expertise.
They had to contact a medical doctor in Florida.
Nice.
Able to, examine.
Right.
And so they brought a nurse in and he would have her like touch her legs, do this, do that. And so he was able to tell them what they did, what tests that they needed to do to find out what was going on with the paralysis.
Okay.
So those were things that were going on. Now, what I'm saying,
I just want to tell everybody, talk about better experience.
Yes, better experience, better pricing. So when you're looking at that, you don't want to say, well, is this doctor going to be in my network? At that time, you don't want to worry about cost.
You want to get well.
You want to get well. You want to have the best experience and everything with that. If you're out of town and something happens, you want to make sure you get the best care and not have to check to say, oh, well, let me see if this doctor is in my network. Those are things that you don't want to have to worry about. And so open enrollment, so I'm so glad we're on here because open enrollment in many states is going to start on November the 1st. With our program, there's no open enrollment. Whatever you want to enroll, you can. So it doesn't matter if it's February, December, June, when you want to participate in the program, you can do that. Again, no network, no out of network. There's no wait for open enrollment or anything like that. So I love that. So know that
that's a big deal, Stephanie.
Yes.
Because then that's huge.
Yes, it is really huge. So that, because some people are waiting, and saying, well, I have to wait until open enrollment. They're looking and seeing where they want to select. They're looking at the doctors and things like that. And so you don't have to do that. So know that there
are like earning a dissertation. When you had to choose during open enrollment and oh my goodness. So
you're looking at, okay, I don't know this doctor. Let me look. Okay. And then, you want to be able to change, or sometimes you can't make changes to your plan until open enrollment again comes November the 1st. So I just want everyone to know that there are alternatives to modern approaches and the rising costs of healthcare. Now, most families with our program have saved as much as $9,000 or more.
Wow.
And so we can save a lot, and we can give you a free quote. You can use this two ways. One, you can use it to supplement the insurance that you currently have, because a lot of people have a lot of out-of-pocket expenses with their insurance. And so if you do, or if you're with the insurance, but you want to go to the primary care physician that's out of network, then with our program, of course, you will be able to do that. And with your program, so you can use it to be able to have that freedom again to choose if you want to go out of network and you didn't really want to pay those high premium costs. Then that's where our program can come in and still can kind of supplement, but still help to keep your costs down. And so for children who are unmarried, they can use your program up until they're 26 years old. And then they can get onto their own program. So those are the things that we do. Now, I just want to share a few statistics with you.
Okay.
There are approximately 30 million people in the United States who are uninsured.
Wow.
And so when you're looking at it, you're saying, well, wow, wait a minute. We got the Affordable Care Act. Yes, we do have that, but there is a income qualification in order to participate in that program. And so if you make over that amount, you don't qualify for that. Or for some reason, in those personal, there are some people who still choose not to pick that particular program, and that's their, decision. But here you can have an option. You can look at this and you'll be able to pick the program. So 1 in 10 adults have filed either for bankruptcy or they owe over $10,000 in medical bills here in the United States too. And so medical debt is the leading number one factor of why people file bankruptcy, Pam.
Wow.
I don't know if you know that. And so
that is so sad.
It is sad.
Stephanie, I didn't know.
Yes, it's one of the number one leading factors of why people file bankruptcy. And it negatively impacts your credit because you owe these medical bills. And so it's impacted your credit. Now, what happened in 2022, because of COVID, and a lot of people did, incur all these medical bills, the three credit reporting bureaus did say in 2022 that they were no longer going to let medical bills negatively impact your credit. So they were not.
Thank goodness.
Thank goodness. But now we don't know how long that's going to be.
Right.
But they did stop that. But prior to them doing that here in 2022, it did. And so it impacted your credit. Now, if it impacts your credit, what a lot of people don't know, remember I said I worked in higher education. So I sit on a lot of committees for hiring and things like that. Your credit is pulled for that. If you're going after a job, they look at your credit, especially if you're going to have a senior level position and you're going to be over a large budget. Well, what they look at, how can you manage our money if you can't manage yours?
Right.
So those are the things that they look at. A lot of people don't realize too that your credit impacts how much you pay for your car insurance.
Wow.
And so it impacts your house insurance, your car insurance, all of these things.
I must go back to this for a second. The fact that there's a credit crisis around healthcare and that negatively can impact families when they've already been through something perhaps difficult, in their health or a loved one's health.
Yes.
It's unthinkable.
It is. Well, some families, when their loved ones got COVID, we had over 1 million people who died of COVID, and they went into the hospital and they got these outrageous medical bills, and they have all these medical bills. And you know what? Sometimes it was the breadwinner. I know in my family, in my husband's family, his aunt and uncle, both in the same household, both ended up with COVID, went into the hospital. He died and the wife did survive. But when you have those medical bills, when you're in there, you're like that. And the breadwinner loses their life. And then you have all these medical bills. That can just really,
talk about the stress.
The stress behind it. And you're just wondering, how am I going to get from up under this? And so they're working those out with the medical facility of how they're going to pay these bills. And as you know, these bills are high. When you go into the hospital and you get an aspirin, well, it's not like going to get an aspirin from the store. That aspirin could be $15 or $25 for one aspirin. And you're looking and you're going, oh my goodness, what is this? One of the things I'll say too is make sure you're checking your bills, because sometimes when you check your bills, there are some things on there that just say, wait a minute now, I didn't get this. And I'm not saying that the hospital is overcharging you, because sometimes with the stress and with everything, there could be some human error. There's human error in everything.
That's right.
But there could be some errors there. So I'm just saying, make sure that any bills, even when you get your credit card bills, make sure that you're protecting that as well. And you're looking those things over to see, are these charges actually accurate? So you want to make sure that you're doing that. So medical debt, as I was saying, is the leading cause of bankruptcy. 2/3 of the people cite that medical bills is the key contributor to their financial downfall.
Wow.
2/3. So you want to look at that. So then also, I said there are 31 million people who are uninsured right now. So just think about, if you do not have health care, if you were involved in a serious accident, whether you were out of town or you were in town, that expense of that treatment can result, again, in poor credit, even bankruptcy. And it can have some individuals who now working full time, and now they're getting a part-time job.
Right.
There are some people who work full time, they go get a part-time job just so that they can have that benefits.
Yeah, they want they want to make ends meet, not have their medical expenses, basically crush their basic needs.
Yes. And so they do that. So they go in and get a part-time job. And so that's why I say access to medical care is critical, because you can go skiing, you could be on vacation, you could slip on something, you can fall, you could break your leg. I know as someone I was going to say is another person who I know who was having a good time on vacation, and that, those little motor scooters, they zipping around town in, got on one of those motor scooters, but they're not used to that. Got on one of the motor scooters and was going pretty fast and went to stop it. But with their knowledge, they put their leg down to stop it.
Ouch!
The brakes, yes, broke every bone, ligament, and everything in their leg.
Ouch!
And they were getting ready to go on a trip to Hawaii, and guess what? It had to be canceled because they had to have surgery and they had to repair that leg, and it took almost a year to do that. And so that's what I'm saying. Those things can happen, and they could be unexpected. She was already, having a good time and wanted to be able to do that. So there are options. There are options when it comes to healthcare. So now, sometimes you can have what we call an employer-sponsored healthcare coverage. This is where you have a healthcare plan that the employers and the company's provider, they have a workforce where they contract with one of the healthcare companies, and you've heard of those major healthcares, and they do that, and they're responsible for choosing the plan, determining exactly what's covered, and typically the employer and employee shares in the cost of those premiums. But now there are some small businesses. Now, for the Affordable Care Act that we talked about, as you know, through the IRS, you are required to provide healthcare insurance if you have 50 or more employees. But if you have 49 or less, you are not required. That's why some people don't have it, and they go get a part-time job. Now, what is happening with some of these small business owners is they're losing some of their employees, or their employees are kind of stressed out because they know they need the health care coverage. Their employer is not offering it because it's 49 employees or less. And so they're either going to go get a part-time job, or sometimes what happens, they're working so much for that employer, they don't really have the time or the energy to go get another part-time job. So they're part of that 31 million that's uninsured. And so small businesses are losing their employees because of this. They're going, and if you're saying we're offering healthcare, then they're leaving and going to another company that even if it's less pay sometimes, because when you average it out, it's like I have the peace of mind that I have the health coverage. So if something happens, I'll take, a little lower pay just so that I can have that and just work one job. So we have solutions for these small business owners as well, or for these employers, these employees. And so we have solutions for them where we can say, we can give you an alternative to that. So that's the first option, is you can have an
So
employee.
Stephanie,
Uh-huh.
small business owners can reach out to you too, especially if they have 49 or less employees.
Yes, that's who I'm going to, at the end, I'm going to say who all I want to reach out to me. So
That's right.
small
Oh,
business
that's
owners who, even if you're offering healthcare insurance, we may be able to save you some money. So we have some plans that we can do to help you with that. So if you're doing and you want to reduce some of those costs, we can help you with that. And then even if you're not offering it, but you want to be able to offer it to your employees, not that you have to pay for it, but you want to have your employees to have access to it and they can pay for it. We could do it either way. So yes, there is a solution. We just need to have a conversation and we can help you with that.
Stephanie, is that something that then virtually for the business owner who has, say, 10 employees or 19 or 38, you could give an information session via Zoom?
Yes. So that's why I said, let's have a conversation. I would love to do that.
Okay.
And so, yes, we could do that. So, so employer sponsored health care coverage is the first one. The second one is the Affordable Care Act, which we touched on just a little while ago. So this allows millions to choose subsidized health care. But as I mentioned, there are many individuals who either do not qualify for this because their income is too high, and there are some, for whatever reason, still have not accessed this. And so then the third option that we would like to say is healthcare sharing. Now, this is a nonprofit membership program. It's a concept that has been around since the early 80s. Some people say, well, I haven't heard of it. And the reason that you haven't heard of it is because it first started out in religious organizations where you had churches and pastors who were full-time and they needed healthcare insurance, but they didn't have that buying power to go one of the major healthcare providers. And so they started with the healthcare sharing. And so that's how it came about. But now, since the high rising cost of healthcare, it has now opened up. Since it started in the 1980s, it has now opened up to include individuals, families, and small business owners.
Oh,
now it's not just religious organizations. All of these individuals now can have access to it. So it's over a $3 billion industry. And so you may say, who's eligible for it?
okay.
So it's all like-minded people, individuals, family, businesses. There's no restrictions based on race, color, religion, or creed.
I love that inclusive piece.
It's inclusive.
And they probably don't care if you're sick already.
There is some things. If you have a pre-existing condition, you just have to be 36 months past that pre-existing condition. However, that pre-existing condition could be in one part of your body, but you could be have the healthcare sharing on other things. And then as soon as you're 36 months past that, then you can start receiving healthcare sharing on that as well. And I was talking to an individual, and she told me, she had cancer, and she said, "Wow, that is wonderful, because the plans that I looked at, I had to be 5 to 10 years past it." And we're looking at 36 months. And so that's really great. So you may ask, what's the difference between healthcare insurance and healthcare sharing? So insurance is a contract that has that policy holder for profit insurance companies. And they pay, again, that expensive premium in exchange for the promise to pay for those bills. So healthcare sharing is a voluntary, not-for-profit. And it began in the 1980s with a religious organization. Today it has grown into an industry that's approximately $3 billion a year. Americans began to turn here because as an alternative to high cost, as I said, for the insurance. And they connect through technology. You can go and visit your doctor or dentist of your choice, your eye doctor, all of those things. You would have a membership card. The same as your insurance provider card, you would have that, and you would be able to go, and they would send those bills electronically to the healthcare sharing, and those how all of those things work. So again, I feel that you deserve simple and affordable healthcare that is comprehensive, that's going to allow you to have prescription drugs covered, chiropractor, dental, vision. All of these things are you can have in the healthcare sharing. Now, you may ask, is there an option for senior citizens who are 65 and older? Absolutely. So we do have individuals who are 65 and older with Medicare. and that's the Medicare Parts A and B. They can be.
That brings me joy, Stephanie.
I know it does. That's why I'm like, I know you were going to ask that. So you can find a lot of things that they typically have. Now, this will be used as secondary to Medicare. Okay. So it is used secondary to there, but again, it's just as simple as you would have a card. And if you go there and if you go to a particular doctor and they're not familiar with it, all you have to do is call the 1-800 number, and they will walk your doctor and everything through it, get them into the system. So if for some reason they're not already in the system, they could get them in the system. The same as when you go to the doctor, the first thing they ask you, do you have your insurance card? And they make a copy of it. They're inputting the information in the system. It's the same way. They'll just ask you when you tell them that you have the healthcare sharing card, or they say, do you have your insurance card? You just hand them that card. They'll type the information in there. It has the 1-800 number on the back, and they'll put all that information in there. And they, the same as what you're familiar with, they will send the bills electronically, just as they do now. So it's just that simple for you to go through and to do that. So who are we looking for? Who do we want to blast? We are looking for, first, individuals who currently do not have health care. We want to make sure that you have health care, because I do not want you walking around and something happens to you.
So if individuals don't have health care, reach out to Stephanie. And even though we covered quite a bit here, when you talk to Stephanie, she'll individualize it.
Yes.
And then you two, you work together to see if it's a fit. Okay, keep going. So individuals, especially those uninsured. Okay.
Yes. And then individuals who are working part-time or a second full-time job so that they can have coverage. We want you to just work that one job, or if it's something that you love, great. But we just want to make sure if you're working that job only because you need the coverage, we're going to help you with that. So we can do that. And
that
then
could free up their time if they have family.
Yes. I love helping people get their time back. And then individuals and families who are having a lot of out-of-pocket expenses or high deductibles. Again, as I said, it can supplement it. So you can be able to supplement that. 1099 contractors. Okay. And so what I mean by 1099 contractors is realtors, real estate investors, service trade like plumbers, electricians, people who are in direct sales and networking marketing. Mm-hmm. If you're in there and you have a significant income and you're not covered by health insurance, typically you're paying a lot. And we have helped people to be able to save significantly on there. Like I said, it could be $9,000 or more a year. Even in the drugs, as I mentioned in the beginning of the interview, we had an individual who was paying, and I think she was in direct sales, and she was paying over $600 a month for a medication that she needed. It's not like she could go out. She didn't have an option, but then she was able to get
the medicines are, people who need them, it's expensive.
It's expensive. It is really expensive, and you do need it. And
that alone, people can reach out to you.
Yes. And you can just see that. And then healthcare, I'm looking for healthcare industry and insurance agents, because sometimes they don't have this particular program, and they want to be able to offer resources to their clients. And so this is something that they can do because they want to make sure that they're covered. So we could do that.
Plus that'll help educate more people.
Mm-hmm. Mm-hmm. Want to do that. And then small businesses, who have 49 or fewer employees, or solopreneurs, we can work with them as well. And then seniors who are 65 and older, who have Medicare parts A and B, we can help you.
I love it. Now listen, Stephanie, how can people reach out to you? What should they do?
Okay. So my phone number is area code 513 348 5008.
5008?
Yes. So
make sure I got it right, Stephanie.
Okay. Okay.
Right. Yeah, because listen, I want people, one thing the audience can tell is that, and I have an affinity for educators. I know you know that, right? Both of us have been in higher ed, and we tend to be thorough, and we care about people. So when you reach out to Stephanie, you find out what could improve your situation, not just your overall health, but your bank account.
Yes.
Mhm.
And I'm going to give you my email too. Now, if you on here, text me.
Okay.
Text
Yeah,
me
it's okay
because
to text Stephanie.
yes, because I am inundated with a lot of phone calls and emails. So that's
I love
my
text.
cell number. And then my email is Steph, STEPH, and then the underscore. And then my last name, ROUSSEAU @yahoo.com. But put in the subject, health care sharing.
Stephanie, I got that correct on the screen, correct?
Yes.
And listen, she really wants healthcare sharing in the subject because when we say Stephanie is busy and thriving in business, we mean it.
I get a lot of
I'm so
emails.
glad
And
we met.
so, yes, I get a lot of emails. And if you put healthcare sharing in the subject line, that will really bring my attention to it. And I would like to get back with you. If for some reason you do email me and it went into my spam, you have my cell number. Please text me. And I do get those, or give me a call and say, hey, I sent you an email. I hadn't heard from you. We can get you a quote. It's a complimentary quote. We can get you a quote. And we just need to know, to get you that quote, we just need to know how many people are in your household. Who is the oldest person in your household? And when I say how many people in your household do you want to be in, to have the healthcare sharing? And what is the oldest person in your household? So we'll get that information from you. We do follow all the privacy acts as far as through the federal government with those. And so we won't ask you all the information. We'll just get that information from you, have someone from the company reach out to you. We can give you that quote, and then we can go from there and find out. I just want to help as many families as I can and make sure that we bring that number of 31 million who is uninsured. We can get that to 0.
Stephanie, I cannot thank you enough. 31 million people are uninsured. Reach out to Stephanie. I in my heart and mind, I know there's going to be some good news after you reach out to her. And then for people that may have insurance or small business owners, seniors, reach out. That free quote could save you over $9,000.
Yes, yes.
Mm-hmm.
We would love to help you, to see what we can do to help you. We do have some other services that we can help you with as well. But I want to start here. I want to make sure that you are protected, that you do have the health care. As you can see, I started out talking about how I was paralyzed. As you can see, I'm not anymore. And it came from having good health care. Right. So I know it does work. Health care does work. We do need it. We're going to need it, all times. This is not a subject that's going to go away. The rising cost of healthcare is here.
And no one should go broke because they need healthcare.
No one should. And no one should suffer in silence either because they don't have it. We don't want you to be financially challenged with it. And we want to make sure that you do have healthcare. And another thing I wanted to mention too, we talked about the uninsured. I don't know if a lot of people are aware of this. If you go to the doctor and you are sick, do you know the doctor has the right to refuse to serve you if you do not have the funds to pay? If you do not have any insurance and you do not have the funds to pay, they do not have to treat you. And I know of someone who did have a gunshot wound, and they just kind of like patched up and sent them on because they had no insurance. And he did not receive the proper health care because he couldn't afford to pay it. And I don't like that. I don't like that. I think that you should be able to receive treatment if it's
and the best quality treatment.
The best quality treatment and all of that. And so I know that a lot of people don't know that. They just think, oh, I'm going to go to the doctor. I'm going to go to the emergency room. No, just because you go to the emergency room, they're going to ask you while you're there, can I have your health card? And that then determines what type of care that you're going to get if you cannot afford to pay for it. They're not going to give you the care that you need. And they may not even give you any care at all. They do by law have the right to refuse you because they are in business for profit as well. And that would just be like you go into a store and you go in there to purchase something. That business owner, just because you don't have the money, they're not going to let you walk out with a dress just because you're in need. And that's the same thing, unfortunately, at the hospital. You can be in need of health care, and that doctor does have the right to refuse to treat you.
So with that, you reach out to Stephanie Rousseau. She will help you to examine options in healthcare sharing that, one, can save you a lot of money. But remember, it's while it's better price, it's also a better experience. And the experience starts with Stephanie because she wants to see if it's a fit for you and how it can help you. With that, Stephanie, I adore you. I know you know it.
Oh,
and I can't wait to see you. I know I get to see you tomorrow.
yes.
And let's see if we can get some small business owners for you to give an information session to as well.
Yes, I hope so.
Okay. Okay. All right. Thank you.
Thank you.
Such a blessing you are.
Oh, thank you. Thank you. You are blessing me too.